So a very good evening to all of you. I am Chian from CPF Board. All right, so first of all, thank you for having us here because we know this is a Saturday evening. So some of you might have wondered like, oh, how is healthcare related to CPF other than the fact that we always sign MediSave withdrawal forms at a healthcare institution? All right, so actually, healthcare forms a very important pillar in the CPF system. And together with housing and retirement income, it gives us the foundation in retirement for all of us. Okay, so for the start, I will share with you a quick overview of the CPF system. And before that, after that, I will hand over to Marcus, who will share with you more on Singapore's healthcare financing system. All right, so first of all, the CPF system is designed for us to meet three basic needs in retirement. All right, first of all, a fully paid up home. All right, so why do we need a fully paid up home? Because in retirement, when we officially stop working, we wouldn't want to still be paying for our mortgage loan because this is a huge part, a huge outlay, be it our CPF savings or cash. All right, so it's very important that we have a fully paid up home in retirement. Okay, it can be any flats, okay, it can be HDB flat or it can be private property, it doesn't matter, so long as it's a fully paid up home. All right, then we go to the right side, okay, then that's where we are looking, where the CPF system provides for a steady stream of retirement income. Okay, and of course, it must provide the income for life, okay, because we all do not know how long we'll live till. All right, so through the CPF system, that's where CPF Life comes in to fulfill that lifelong stream of payouts in retirement. All right, and last but not least, which is the topic for the day, okay, which is to have sufficient insurance and savings for our future healthcare needs. All right, because as we all know, as one person ages, or rather as we age, our physical conditions, our mental conditions may not be as good as when we were younger. All right, so as we grow older, then we may have more medical issues that may require follow-up and treatment. And when you're not working officially, then how do we find the savings to help us tide through all these medical episodes? All right, so that is why in retirement, we need to have sufficient healthcare savings to meet all these future healthcare needs. All right, so next, so let me just share with you very briefly on how CPF actually helps us save for it. In fact, it helps us, the system is designed to help us save for this the very first day we start working. All right, so why do I say so? So as we work, be it in our first job or currently in whichever point in our career, we will always have CPF contributions, right? So it can be like 20% for those who are younger and slightly lesser for those who are older. All right, so on top of that, our employer also contributes a portion of our wages to our CPF account. Okay, so for example, let's say for every $1,000 that you contribute into your CPF, okay, your employer actually contributes $850. All right, so that's a huge amount. And over time, okay, it grows in the CPF, okay? It grows through compounding interest. And that is, you know, like the snowballing effect where our savings just grow over time, all right? And last but not least, when we retire, okay, that provides us with a lifelong stream of retirement income. Okay, so here are our three BFFs, okay, CPF best friends forever, that have stuck with us, be it through thin or thick, be it through when we are younger or now when we are older. All right, so they are the ordinary account, special account, and the MediSave account. All right, so the ordinary account pays a interest rate of 2.5% per annum, while the special and MediSave account pays us 4% interest per annum. And when you reach the age of 55, that's where the fourth friend comes and joins the party. Okay, you see, group of 5, right? So 4 accounts plus yourself, 5 of us. Okay, so that account is the retirement account, all right? So this is where you will get the retirement income, okay, from the retirement account. And this gives us 4% per annum as well. Okay, and for those who are above 55, okay, the good news is your first 30,000 in your CPF balances will earn an additional interest. So for your retirement account, it will earn 4 plus 2%. Okay, so that's up to 6%. And the second 30,000, that's where we have up to 5%, which is 4 plus 1%. All right, and then the excess, okay, will follow the 4 and 2.5% interest rate. So all this to help us grow our retirement savings faster. Okay, so I hope you have a good overview of the CPF system. So right now, let me pass over to Marcus. He will bring you through Singapore's healthcare financing system. All right, so Marcus, please.
So thanks, Chian. I think that was a really useful introduction. And so again, my name is Marcus, and I'm proud to be here today to talk to you about healthcare financing in Singapore. Healthcare is a big part of retirement, and it's important to know what schemes are in place so that you can take charge of your healthcare costs in retirement. So before we begin, I thought to make it a bit more interactive. List 3 words that come to your mind when you think of the word healthcare. So we'll see a nice word cloud that forms. So when you can, list 3 words that come to your mind when you think of the word healthcare. So don't need to think too much, just the first 3 words that come straight to the top of your mind. And we'll wait a little bit for the word cloud to appear. Okay. So okay, we are seeing the results slowly trickling in. The first word that is the biggest here is money. So I think you all got it right. Healthcare is expensive, and we are trying our best. And one of our main goals in MOH is really to try to keep healthcare sustainable and affordable for all. I see another word, expensive, and that's not surprising. Expensive or healthcare costs rising is a phenomenon that is known across the world. Even in Western countries such as the US, what you may think is that if you get sick in the US, you will go bankrupt. And that's what we don't want to achieve. That's a phenomenon or situation that we don't want to have in Singapore. Okay, so we'll move on first. Healthcare in retirement is important, and it's a big part of your retirement needs. Retirement should be a time where you can relax, enjoy the fruits of your labor, and and spend time with your loved ones. So why should you care about today's talk? First, to have a peace of mind. Knowing what schemes are available in place will allow you to plan ahead, allow you to be able to know what you need to do when you fall sick. So peace of mind is important. Just like doing a fire drill in the office, we need to be prepared to know what to do when that undesirable event occurs. And as I said, knowing the schemes available in place allows you to plan ahead, optimize your retirement early. And lastly, to allow you to take charge. Nobody wants our lives to be put in the hands of others. And learning about healthcare when we are sick is not the right time. So knowledge is strength, knowledge is power. So take charge by knowing what healthcare schemes are there to help you today. So many of you may be familiar of the S plus 3 M's framework, which is a useful way to remember the 4 lines of defense the government has to protect you against healthcare costs. First, subsidies. Subsidies are government tax-funded and provided by the government, and subsidies vary by your income, or what we call means test. Second, the first M of the S plus 3 M's is MediShield Life, which is a big part of your insurance. Insurance pools risks and resources to protect you against large healthcare costs. Thirdly, MediSave, which is the second M, which is what we save up through our working life to pay for our healthcare needs in retirement. And lastly, as a safety net, for those that can't afford their subsidized healthcare after MediShield Life, after MediSave, we have MediFund. And we'll go through all of these 4 lines of defense today. The most important thing to remember is that all these schemes work together across all healthcare settings. So it doesn't matter whether you are visiting your local GP or if you need long-term care needs in a community. Our schemes work together to ensure that healthcare is affordable across the settings. So first up, subsidies. Subsidies ensure that those who need more get more support. So you can get up to 80% subsidies off your bill for your inpatient and long-term care needs. For your outpatient needs, you have up to 75% subsidies for your bill. The thing to remember is that subsidies vary by three main considerations. Firstly, your citizenship. So Singaporean citizens get the most subsidies, permanent residents get a bit less, and tourists get no subsidies, of course. Second, your choice of ward class. So if you choose to stay in a public hospital, in a B2 or C class ward, you can get more subsidies. So for example, if you stay in a C class ward, up to 80% subsidies. If you choose to stay in a private ward in a public hospital, for example, an A class ward, you will not have any subsidies at all. The main difference between these wards is just the amenities that you may receive. So in an A class ward, you may have air conditioning, and you won't need to share the ward with other people. But in a C class ward, you get just fan, and you have to share the ward with other people. But of course, you get subsidies. And thirdly, subsidies vary by your monthly income. So people who are on the poorer end get more subsidies because they need more help. So you may think that subsidies are only available in our public healthcare institutions. But that has not been true since the introduction of CHAS in 2012. And CHAS has been extended to all Singaporeans with chronic conditions since 2019. Similar to hospitalization or outpatient subsidies, CHAS subsidies are means tested, so they vary by your per capita household income. There are also different CHAS subsidy limits depending on your type of treatment, and if your chronic condition is considered complex, you get higher limits, higher subsidy limits. The main difference between CHAS subsidies and that of hospitalization subsidies is that hospitalization subsidies is a percentage of your bill, while CHAS subsidies is not. But they both work on the same fundamental principle, that we want to ensure your post-subsidy bill is affordable for you. How do I know if I can use CHAS subsidies? You see the nice logo that you see on the left of your screen? If that's placed in the front of your local GP doctor, they are CHAS accredited. And if you have a CHAS card, you can go in there and CHAS subsidies will apply for your condition. So these are the three types of CHAS cards that you can receive if you apply. And if you want to apply, you can go to www.chas.sg. So people who are on the poorer end or those who need more help will get a CHAS blue card, while others will get a CHAS green card or CHAS orange card. Not shown here as well are Pioneer and Merdeka generation cards. So these are for the elderly, and they receive CHAS subsidies at their local GP clinics as well. So you can find out more about what subsidies apply by going to chas.sg, or if you visit your local CHAS accredited GP, you can just ask the clinician. So that's subsidies. Next up, we have insurance. MediShield Life is a big part of insurance. What is MediShield Life? MediShield Life is universal health insurance, and it's basic universal health insurance to provide you with lifetime protection against large hospitalization bills. All Singaporean citizens and permanent residents are covered by MediShield Life for life. That means there are no exclusions on pre-existing conditions, no exclusions on medical condition, and no exclusions on age. What does MediShield Life cover you for? It covers you for your hospitalization and selected costly outpatient needs. For example, chemotherapy for cancer or dialysis. But how much does MediShield Life cover me for? MediShield Life covers you subject to claim limits. And these claim limits vary depending on the type of treatment you receive, the length of stay, the type of hospital you go to, and complexity of the surgery you require. So there are a lot of things. But the main thing you need to remember is that MediShield Life claim limits are sized to be sufficient for the vast majority of subsidized treatments. For unsubsidized treatments, MediShield Life still pays out, but because unsubsidized treatments are larger, the MediShield Life payout will be a smaller percentage of your bill. There are two key words you need to remember when you think of insurance: premiums, which is what you put in, and payouts, which is what you get out. MediShield Life premiums work by pooling our resources with people of similar age range as us. So as we get older, we need to draw more and more on the pool of premiums that we put in, because we get older and all of us need more and more healthcare as we get older. So premiums increase with age. But not to fear, for people who are lower to middle income, government provides subsidies of up to 50% to help you afford your MediShield Life premiums. We know that familial support is important as well. So your loved ones or you can pay for your MediShield Life premiums for your loved ones as well. And lastly, MediShield Life premiums are fully payable by MediSave. So many of you may not even need to incur any out-of-pocket when paying for your MediShield Life premiums. Next, we have payouts. So what you put in is premiums, and payouts is what you get out. There are a few key aspects to payouts. So you look at the diagram on your right, you look at the top bar called portion of bill above claim limits. As I said before, these claim limits depend on various factors, but they are sized to be sufficient for the vast majority of subsidized treatments. Then we look at the bottom bar called your deductible. To ensure that MediShield Life provides coverage for the larger hospital bills, for the larger bills, where coverage is most important, we have a deductible of $1,500 to $3,000 per year. This is only payable once per policy year and accumulates across your claims. Next, we have co-insurance. Co-insurance is 3 to 10% of your claim amount and generally reduces as your bill gets larger. And why is this co-insurance important? Because we want to ensure that everybody has some skin in the game. By ensuring there is some co-insurance, people are better able to make rational decisions about their healthcare, and people supplying the healthcare to you will exercise more discretion as well. So this keeps premiums affordable and sustainable for all by making sure that everyone plays our part to keep healthcare costs down. So everything, such as your deductible, co-insurance, and portions above the claim limits, can be payable by MediSave and/or cash. And we'll get to MediSave in a bit. But what is important to know is that subsidies, MediShield Life, and MediSave work together to keep your healthcare bill affordable. But what if I wanted more coverage? What if I wanted to stay, for example, in an A-class ward and seek unsubsidized treatment? And that's where integrated shield plans come in. Integrated shield plans are optional MediShield Life add-ons. They are provided by private insurers such as NTUC Income, Great Eastern, Aviva, and so on. And many of you might have integrated shield plans or IPs today already. What do they cover? They cover a similar range of treatments as MediShield Life. But because they are optional schemes, they may exclude pre-existing conditions. So it's important for you to talk to your insurance agent so that you know what conditions are excluded. So that prevents you from going to a hospital for a condition that may be excluded and you having a big shock when you see the bill. How much does integrated shield plans provide you? Because there are so many different types of plans, the exact benefits vary. So again, it's important to talk to your insurance agent to figure this out more in detail. But generally, they provide you with higher claim limits and coverage. But with these higher claim limits and higher benefits, they also comes at a cost, which higher premiums, which rise with age. So many of you may have an integrated shield plan already, but it's still important to ask ourselves this question. Do I need an integrated shield plan? To help distill this question, we thought of two simple questions you can ask yourself. Firstly, do you wish to stay in private wards and/or choose your own doctor? In fact, subsidized treatments make up 2/3 of admissions from Singapore residents today already. And MediShield Life provides sufficient coverage for the vast majority of these treatments. So if subsidized treatments are good enough for you in a public hospital, you may not need an integrated shield plan. Secondly, can you afford your IP premiums in the long term? IP premiums can be up to 4 times your MediShield Life premiums when you are in your 70s or 80s and no longer working. So this is quite difficult to finance. For example, when you are 80 years old, your MediShield Life premiums before subsidies is about $1,600. But if you had a private hospital integrated shield plan, you had to pay an additional $8,000. And this doesn't include riders that you might have that further adds to your out-of-pocket costs. Sure, you can use MediSave to pay some portion of your integrated shield plan. And this is subject to what we call the additional withdrawal limits. But do note that this only goes up to $900 per year. So there is still a substantial portion that you need to pay out of pocket. So these two questions should guide you in better knowing whether you need an integrated shield plan or not. The most important thing is to pick a plan that best suits your needs. If you think subsidized treatments in public hospitals are good enough for you, then you may not need integrated shield plan. MediShield Life provides you sufficient coverage. Many of us know that Singapore has an aging population. In less than 10 years' time, 1 in 4 of us will be aged 65 or older. And many of us are living longer as well. At age 65, we can expect to live another 21 years or so. That means more time to enjoy our retirement, more time to spend with our loved ones. But that also means that there is higher risk of disability as we get older. Because that happens when we get older. There's a higher risk of incurring disability. And in fact, 1 in 2 healthy Singaporeans aged 65 could become severely disabled by the end of our lives. So how do we protect ourselves against this? Nobody wants to be severely disabled. And we need to protect ourselves against this adverse outcome. So that's why we introduce long-term care insurance, to provide you greater assurance that you can afford your long-term care needs if you become severely disabled. So we have ElderShield, which is an older scheme, and we have CareShield Life, which was announced last year. What are these schemes? These are basic long-term care insurance schemes that provide you monthly cash payouts if you become severely disabled. If you are born in 1979 or earlier, ElderShield and CareShield Life are optional schemes for you. Some of you may already be auto-enrolled under ElderShield today. If you are born in 1980 or later, CareShield Life provides universal mandatory coverage for everyone. So this includes anyone with pre-existing disability. How much does it provide you with? So it provides monthly cash payouts. ElderShield has 2 schemes, ElderShield 400 and ElderShield 300. ElderShield 400 provides you with $400 a month up to 6 years, and ElderShield 300, $300 a month for up to 5 years. CareShield Life does one better. It provides you with lifetime cash payouts that increase until age 67 or when a claim is made. So for example, if you are severely disabled in 2021 this year, you get a cash payout of $612 per month as long as you remain severely disabled. CareShield Life premiums are kept affordable through a variety of means. ElderShield premiums are payable until age 65 and start at age 40, depending on when you join. CareShield Life premiums are payable until age 67, or a minimum of 10 years, depending on when you join. Subsidies are there as well, only for CareShield Life. And this is because CareShield Life provides universal mandatory coverage for everyone. ElderShield is an optional scheme. That's why the government does not provide subsidies for it. For CareShield Life, if CareShield Life is optional for you, so you are born in 1979 or earlier, you have participation incentives. If CareShield Life is mandatory for you, we also provide you with transitional subsidies. On top of that, we have means-tested subsidies, just like your MediShield Life. So people who need more help can get the help they need to pay their insurance premiums. And for those that still can't afford their CareShield Life premiums, after subsidies, after familial support, you can tap on additional premium support. CareShield Life premiums and ElderShield premiums are fully payable by MediSave, so many of you will not have any out-of-pocket as well. And family members can pay for their loved one premiums, just like MediShield Life. So a question that we get a lot is, Am I covered under CareShield Life? So this is an important question. For those born in 1980 or later, it's a very easy answer for you. You are covered. CareShield Life provides you with universal mandatory coverage. If you are born in 1979 or earlier, CareShield Life is optional, and you can only join if you are not severely disabled yet. So if you are born in 1970s and you have ElderShield 400, you'll be automatically enrolled. If you are born in the 1960s or earlier, you can apply to join at careshieldlife.gov.sg. And for those where CareShield Life is optional, we encourage you to join CareShield Life. As I said, we are aging more and more, and the risk of disability increases as we age. So we need to be protected so that we can afford our long-term care needs when we are older, so that we don't overly burden our caregivers, we don't overly burden our family members. So why should you join CareShield Life? If you are on ElderShield today, CareShield Life provides you higher cash payouts. So as we saw, ElderShield 300 and 400 has only $300 or $400, and it's time limited. ElderShield has higher limits, higher cash payouts, starting at $600 last year, and now it's at $612. As I said, CareShield Life provides you with lifetime cash payouts, as compared to ElderShield, which is time limited. So there's more assurance for you. And lastly, to encourage you to join early, we have participation incentives of up to $400 a year for 10 years. So that means cumulatively, that's $4,000 per year. But this applies more for the Merdeka generation or Pioneer generation elderly. If CareShield Life is optional for you, there is still participation incentives, although it might be a bit lower. So we really encourage you to join to protect yourself from your long-term care needs in the future. Similar to MediShield Life, CareShield Life and ElderShield also has supplements. And these are provided by private insurers. So you think of CareShield Life or ElderShield as your basic long-term care insurers, and these supplements provide additional top-ups. The benefits vary across the plans, but generally provide you with higher monthly cash payouts. And the premiums are higher as well, because you get more benefits. And the premiums vary across the plans as well. Supplement premiums are payable by Medisave as well, but they are subject to a limit of $600 per year. So this is something you need to take into account as well. Do I need a CareShield Life or ElderShield supplement? And can I afford the premiums in the long term? These are some questions you can ask yourself when thinking about buying a CareShield Life or ElderShield supplement. So that was quite fast. We talked about subsidies that occur both in the public healthcare institutions and some selected private GP clinics or dental clinics under the CHAS scheme. Then we talked about insurance. Insurance, we have our hospitalization insurance through MediShield Life. Then we have CareShield Life that provides you with long-term care insurance. And for our insurance schemes, it's like a public-private partnership where there's an additional top-up offered by private insurers. So your integrated shield plans for your MediShield Life and your supplements for your CareShield Life. And throughout the slides, you have heard a lot about Medisave. Medisave is an important account. It's one of the 3 or 4 CPF accounts that you will have across your life. And many of you will be quite familiar with Medisave already. We contribute 8 to 10.5% of our monthly income to Medisave. The government helps as well by providing top-ups. And you can also contribute voluntarily more to your Medisave account. Your Medisave account additionally grows at an attractive interest rate of 4 to 6%, as what Chian had pointed out previously. But as a savings account, we need to have a cap to it. Why? Because we don't want you to oversave for your medical needs. Because this results in higher demand for medical needs that is unnecessary in the long term. That's why your savings are kept at what we call the basic healthcare sum. And we'll talk more about this in the next slide. Medisave users are there when you need it as well. So when you fall sick, you can tap on your Medisave. But these users are subject to withdrawal limits. So what is the basic healthcare sum? Think of your Medisave account as a jar, and the cap to your jar is the basic healthcare sum. The basic healthcare sum is the estimated savings you need for basic subsidized healthcare in old age and serves as a cap to your MediSave account, as I said. Currently, it is $63,000 for those aged 65 and below in 2021. It is adjusted annually to keep pace with the growth of MediSave use by the elderly. It is fixed for life when you turn 65, and annual adjustments, as I said, only apply to those aged 65 and below in that year. So if I'm 65 this year, my BHS is 63,000. When I turn 66 next year and the BHS is revised, my BHS remains at 63,000. A common misconception we get is that I need to top up my MediSave to the BHS. And that is not true. It is not mandatory for you to save up to the BHS. If your MediSave savings is less than a BHS when you turn 65, you may wish to top it up. But it is not necessary for you to do so. If you don't, there are no restrictions on your CPF usage. There are no restrictions on your MediSave usage if you don't have enough, if you don't have savings up to the BHS. So when you need MediSave, you can tap on it. So previously the BHS is the cap. Now we have the MediSave tap. MediSave is primarily for your hospitalization and selected outpatient needs. It helps you afford your co-payment after subsidies and MediShield Life. But over the years, we have expanded the uses of MediSave. So now it can be used for a wide variety of things, from your prenatal needs when you're pregnant, under the MediSave maternity package, all the way to your chronic condition needs in the outpatient setting. And over time, we will add more and more flexibility to the use of MediSave to keep it relevant for you. Most important thing to remember is that MediSave withdrawal limits are sized to be sufficient for your healthcare needs after subsidies and MediShield Life. So if you go for unsubsidized treatments, the limits are typically not sufficient for you. Before I move on, I just want to say that these withdrawal limits are sized to make sure that you can afford your current treatment and also ensure that you have sufficient savings for your future healthcare needs, which can range from your direct medical expenses to paying for all your insurance premiums as well. MediSave is also there to help you take care of your long-term needs. That's why we have MediSave Care. What is MediSave Care? It is monthly cash withdrawals from your account or your spouse's account. How much will it be? It is up to $200 a month, but the withdrawal amount depends on your MediSave account balance. You are only eligible for MediSave Care if you are severely disabled, so similar to CareShield Life, and have a minimum of $5,000 in your MediSave account. So to tie everything together, we thought it's quite interesting or quite exciting for you to run through a real-life example of a bill. So to bring you all through the bill, Mr. Tan is a 71-year-old Singaporean, so an elderly man, with a monthly income of $2,000. He suffered a heart attack and was rushed to an ALE of a public hospital. He required a heart operation, so the TOSP is a table of surgical procedures, which is an exhaustive list of MediSave and MediShield Life claimable surgical procedures. It ranks the complexity of procedures from 1A, the most simple, to 7C, the most complex. And our withdrawal limits or MediShield Life claim limits increase as your procedure becomes more and more complex. Mr. Tan also had a 9-day stay in a C-class ward with 1 week in the ICU. Before subsidies, insurance, and MediSave, his bill is a shockingly high $53,800. This is more than 2 years of his income, which Mr. Tan definitely cannot afford out of pocket. So let's see how our healthcare financing system works to help Mr. Tan. So what do you think is the bill amount after subsidies? So I think we are pulling up a poll to ask you what the bill amount after subsidies is. So I think you can just answer the poll quite easily. So we are getting quite a range of answers. but I think majority of people are getting it right. So just wait another few seconds. Okay, yeah, I think most of you understand how subsidies are applied. So for all of you who answered 10,760, you are right. Subsidy amounts, as I said, vary by three main determinants. Citizenship, Mr. Tan is Singaporean, so he's eligible for the most subsidies. Monthly income, Mr. Tan is relatively low-income individual, so he can get more subsidies. And his choice of ward class. He stayed in a C-class ward, so he's eligible for 80% subsidies. So taking 80% off your bill, Mr. Tan only has about $10,000 left. This is still quite high, at about 5 to 6 months of his monthly income. So let's see how Mr. Tan can continue to benefit from insurance and Medisave to further offset his bill. So this one's a bit tougher, almost as tough as a PSLE math question. So let's see whether you can get it right. To determine his payout, you need to do 3 steps. First, determine the maximum claimable amount from a Medishield Life. And this varies across the, as I said, the length of stay, the type of ward he stays in, the complexity of his surgery. Then we subtract the deductible, and we subtract the co-insurance. So let's see, I think we have a poll now. And you can try your best, try to figure out what the Medishield Life payout will be. So again, I think many of you really understand healthcare financing and seem to be able to do math pretty fast. If I was you, I think it would be quite difficult for me to calculate what is the co-insurance and calculate a deductible. If you're guessing, I think you all have very good luck this evening. I think majority of you got it right. So let's break it down into steps. The maximum claimable amount for Mr. Tan is 10,760. How do we get that? We look at his length of stay, which is 9 days, and because he stayed in an ICU ward, Medishield Life claim limits are higher. And for the first 2 days of stay, he gets an additional 200 from his Medishield Life. Why? That's because in your earlier period of your hospitalization period, you have more tests and diagnostics so that a doctor can understand your condition. That's why we have higher limits for the first 2 days of stay. Next, we have a surgical operation that is pretty complex. So actually, if we sum all the claim limits, he can claim up to 19,760. But of course, the payout is kept at a bill amount after subsidies. Next, we have the deductible. So we reduce the deductible by $1,500. And then next, the co-insurance. So the co-insurance starts at 10%, reduces to 5%, and then falls to 3% for higher bills. So for Mr. Tan, the co-insurance is $623. So we take 10,760 and minus the deductible and co-insurance, we have $8,637 left. So the amount after subsidies and Medishield Life is much more manageable, just 1 month of Mr. Tan's salary. But that's quite difficult for someone who may be just making ends meet. Earning $2,000 a month may not mean Mr. Tan has that much savings to fall back on. But thankfully, Mr. Tan has Medisave. So I think in the interest of time, we'll try to go through this Medisave part a bit faster. The withdrawal limits depend on your length of stay and the complexity of your surgical operation. And of course, you cannot claim more than what is outstanding after subsidies and Medishield Life. So you can try to poll what is Mr. Tan's Medisave withdrawal. I think most of you will get it right. 3 out of 3 is pretty amazing. Okay. Yeah, so I think you all understand how healthcare financing works. So I think this one is quite easy. Medisave withdrawal limit is 2,123. So whatever is outstanding after subsidies and Medishield Life, Medisave is claimable. So you can see from the table, Medisave withdrawal limits are $550 for the first 2 days, and then $400 on day 3 and thereafter. There's also a surgical operation that you can withdraw about $4,650, but you can't withdraw more than what is your outstanding bill. So our schemes work together to ensure that there is affordability for bills like Mr. Tan. But for some people, there may be still some out of pocket. So what happens if you can't afford that out of pocket? That's where we have MediFund. MediFund ensures that no one will be denied necessary treatment due to an inability to pay. It is a safety net to help Singapore citizens after subsidies, after MediShield Life, and after MediSave. How much you get depends on the socio-economic circumstances you are at and the size of the bill that is outstanding after our S+2Ms. So talk to your medical social worker if you need financial assistance, and they are more than happy to help you through your tough time. Similarly, for your long-term care needs, we have Elder Fund. Elder Fund are for those that are severely disabled, lower-income Singaporeans who do not benefit from CareShield Life or ElderShield and cannot tap on their MediSave. They provide you $250 per month as long as one remains severely disabled. So this is another safety net for you. So that was quite a quick run-through of healthcare financing in Singapore. And I hope it gives you enough information to take charge of your retirement needs, your healthcare needs in retirement today. So have a peace of mind by knowing what schemes apply to you, optimize your retirement savings and healthcare insurance to best meet your needs, and understand how schemes are available for your healthcare needs in retirement. And before I end, if you can't remember anything else, I want you to remember one word, and that's assurance. Assurance that our healthcare schemes work together to ensure that your healthcare bills are affordable for you. Not only for this generation, but for the next generation. Long-term healthcare affordability is what we are striving for. Secondly, assurance that if you can't afford your medical needs, there are safety nets for you. No one will be denied access to necessary medical care just because you can't afford it. If you can't afford your MediShield Life or CareShield Life premiums, there's additional premium support. If you can't afford your hospitalization or medical bills, there's MediFund. And we are all here to help you ensure that healthcare costs is affordable and you can rest at ease. Lastly, be assured, because our healthcare financing schemes are constantly under review, to make sure that they remain relevant for you, and also to ensure sustainability of long-term healthcare costs. We are working hard every day, and I work with some of the best colleagues, and they are working hard to make sure that our healthcare scheme deliver the best outcomes, deliver the best health for you and for future generations. So I hope you enjoyed the talk. I think we'll go to some Q&A, and I look forward to the questions that you might have. Thank you.
All right, so I think it's a very insightful sharing, to be very frank. How I wish such talks were available back then, because personally, I have gone through, I think, 4 operations, and with each operation, I learned a little bit about healthcare financing. So actually, I went through an ACL, then that's where anterior cruciate ligament tear.
Yeah.
And that's where I learned about integrated shield plan and deductible, because I ended up having to pay for the deductible because I didn't know that I need to get something on top of that. And then after that, I learned about exclusions from IP, because I think my 3rd operation, that's where I was hit with a condition that was excluded. Then I have to pay that full medical bill, like more than 10,000. So I really, how I wish back then there was such information, and then we can all learn about it. All right, so probably let's you ready?
Yeah, let's go.
All right, that's great. So actually, we do see a lot of questions submitted. So do bear with us. That if your questions are not answered, I mean, due to the lack of time, so just bear with us for this. All right, so I see the first question. Wow. Okay, let me take the first question. How about that? All right, so the question goes like this. What happens to the excess CPF contributions to my MediSave account if I have already maxed out my MediSave account from my work contributions? I think it's a very good question, because actually, if we have been working, stay employed through your career, right? There's a high chance that you can hit your basic healthcare sum. and then what happens to that, right? So actually, the good news is the money will not overflow, will not keep going to the MediSave account. In fact, it will overflow to the special account to help you speed up your savings for your retirement. So I thought, that's to address this question.
Yeah, I think that's quite good because even contributions to your MediSave can also help you with your retirement needs because of these overflows from your basic healthcare sum.
Yeah. So if you have maxed out, don't worry. It will not go to elsewhere. Okay, it will go to your special account. All right, so let's take the second question.
Yep.
Okay, so I think this is more for Marcus. Okay, my income was greatly reduced due to COVID-19, and I'm sure these 2 years has been it's really quite difficult for many of us. So what happens if I am unable to pay for my MediShield Life and CareShield Life premiums? Marcus?
Yeah, so this is a great question. And we recognize that this has been a tough time for many Singaporeans. And some Singaporeans definitely indeed need some support. So the government provides support for MediShield Life premiums through means-tested subsidies. So for the lower income, you can get up to 50% subsidies for your MediShield Life premiums. And if you are elderly, Merdeka generation and Pioneer generation subsidies apply as well. We also recognize that familial support is important. So you can pay for your loved ones' MediShield Life premiums as well. And these MediShield Life premiums are fully payable by MediSave. So many of us actually would have saved up prior to COVID. And if you are still having a tough time during COVID, you can rely on your MediSave savings. And that's the intent of MediSave, actually, as that additional layer of protection for you. If you still can't afford it, okay, maybe I'll talk about CareShield Life first. CareShield Life is similar. We provide means-tested subsidies based on your income. For those of whom CareShield Life is optional, you have a participation incentive. So I said up to $4,000 spread across 10 years. Then you have then you have transitional subsidies for which CareShield Life is mandatory for you. For those of whom can't afford MediShield Life and CareShield Life premiums, after the subsidies, after familial support, after MediSave, you can tap on additional premium support. So you'll be invited to apply. So rest assured that we recognize that people are having tough times during these years, but nobody will lose access to MediShield Life and CareShield Life due to an inability to pay.
I think indeed, it's a very good. The last sentence actually resonated with me. Like no one will actually fall out of medical care or medical support due to financial difficulties. Yeah, because I think in my line of work, because I do a lot of talks, right? So actually there was this. I came across like a few Pioneer generation, Merdeka generation seniors. Yeah. Then they quipped with me. He said, "Hey, Mr. Ong." And I was like, "Oh, yes." He said, every year government do MediSave top up. Then my IPG, I still get some more, a bit more. Actually, all this cover for my MediShield Life premium already. In fact, I still earn a little bit, like less than 100 or 100 over dollars. So actually, I think that's how the system is designed. Yeah. Particularly, I think, for the Pioneer generation and Merdeka generation seniors. Yeah, definitely. Because we recognize that the Pioneer generation have less time to accumulate their MediSave savings. That's why we provide all these top-ups. And as I said, trust subsidies also apply for your Pioneer and Merdeka generation. So you can get quite heavy subsidies for your outpatient needs as well, which is very helpful for many of the elderly. Yes, definitely. I think my parents also rely on the CHAS card, the PG card. Okay, let's take the next question. How do I know if I'm covered under an integrated shield plan? This is a common question. Okay, so it's very easy. All you need to do is just log into your CPF account on our website using our SingPass, right? Just go to My Messages. So that's where, as you scroll down, you will see this healthcare portion. And then they will tell you whether you are covered under integrated shield plan or MediShield Life. So let's say if you are covered under integrated shield plan, right? They will just say, oh, you are covered under XX company like Aviva, Great Eastern, Raffles Health, etc. I actually want to commend the CPF colleagues because they recently upgraded the website, right? Oh, yes. And so it looks it looks really nice now. And the CPF app works great as well. So recently I think these two went through a facelift. So it's really, the contents are actually much easier to navigate compared to the previous version. So if you have any more questions that are not answered during the segment, you can always go there to find out more. All right, let's take the next question. Okay, so why do I still need CareShield Life if I am sufficiently covered with MediShield Life and my integrated shield plan? Maybe Marcus, you want to share with
so I think this is a good question, but this is a common misconception that people have. Because CareShield Life and MediShield Life and MediShield top-ups, the MediShield Life add-on, which is integrated shield plan, provide different coverage for you. MediShield Life is a basic hospitalization insurance that helps with your medical needs. CareShield Life, on the other hand, is a long-term care insurance. So if you become severely disabled, MediShield Life and your IPs may not always sufficiently cover you for your long-term care needs, such as hiring a caregiver. That's why CareShield Life is still important for you. Because long-term care needs are so varied, MediShield Life mainly focuses on your hospitalization and selected outpatient needs. CareShield Life gives you cash payouts for life when you become severely disabled. So they serve complementary purposes, and there is no overlap in the coverage. Both provide you coverage for your long-term care needs under CareShield Life and your hospitalization needs under MediShield Life and your IPs.
Yes, I do agree. I can't agree more with Marcus on this as well, because let's say if we are down with a hospitalization episode, right, then our integrated shield plan typically provides for post-hospitalization for a certain period of time. And then what happens after that? So actually, to cite my own example, right? So when I had my ACL tear, I had 90 days post-hospitalization coverage. Then, but my recovery took me 9 months. So actually, for the last 6 months of my treatment, right, I actually fork out from my own pocket. And because I was at a private hospital, so I tend to pay more because it's not so-called there's little to no subsidies for that treatment. So actually, that's where the long-term care comes in. Okay, particularly if let's say if the patient or if the member is severely disabled, then that will help defray part of the cost, like mobility needs or caregiver or even a nursing or a recuperation community care center.
Exactly.
All right, let's take the next question. Can I use more of my MediSave to pay for my medical bills in retirement? Marcus.
So I'll take that. So MediSave is for your retirement needs in your healthcare needs in retirement. You save up just for this. And therefore, while MediSave limits are sized to be sufficient for the vast majority of subsidized treatments after MediShield Life payouts, we recognize that the elderly do need more. So over the years, we have increased flexibility for the elderly to use their MediSave, especially for their outpatient needs. For example, in 2015, we introduced Flexi MediSave. And Flexi MediSave then was allowing you to withdraw $200 from your MediSave or your spouse's MediSave if you're age 65 and above. And over time, we have further relaxed the criteria for Flexi MediSave. So now, if you're age, in 2018, we reduced the age criteria from 65 to 60. And just this year, we increased the withdrawal limit from $200 to $300. So this means more elderly can benefit, and more of their out-of-pocket is further defrayed through MediSave withdrawals. Also, we have MediSave Care, as I said. If you become severely disabled when you're elderly, you can use up to $200 from a MediSave per month to defray your long-term care needs. So we will continue to review the uses of MediSave and ensure it remains relevant for all of you. And this applies across all our healthcare financing schemes.
I mean, I do recognize, I also do see the increase in the flexibility of the usage of MediSave. But I think at the end of the day, that needs to be it's a delicate balance to be struck, because on one hand, while we want to increase the flexibility, on the other hand, we also need to prevent our savings from being depleted too early. Because we all do not know how long we will live till. So we need to ensure that the amount can meet our future healthcare needs, especially in the very old age, like 80s, etc.
That's correct. Because your MediShield Life premiums do increase as well, it's important for you to have sufficient MediSave so that you can pay for these premiums and also all your healthcare needs that come very much towards the end of your life.
All right, so let's take the next question. Maybe I can take that. I am a self-employed person. do I still need to make MediSave contributions? So the answer is yes. If you're a self-employed person earning a net trade income of more than, I think, $6,000 a year for the year, then as you declare your income to IRAS, then that's where CPF board will notify you, okay, what is your net MediSave contributions for the year? Okay, reason being, like what Marcus has said, and I couldn't reiterate, is that we all need a decent amount of savings for our healthcare because we do not know when something will strike us. Yeah. So the answer is yes. Okay, so you still need to make MediSave contributions. All right, so let's take the next question. Oh, it's a very good question. I would like to do a MediSave top-up, about $6,000 to my dad's MediSave account. Do I get the new $8,000 tax relief for this amount? Note, still got notes, bracket, from 1st Jan 2022. All right, so I can take that.
Yeah.
So for those who are not aware, actually recently we have expanded or rather increased the amount of tax relief for topping ups to your special account, retirement account, or even a MediSave account from the $14,000 a year to $16,000 a year. So that gives us $8,000 if we top up for ourselves, and then another $8,000 if we top up for our loved ones. All right, so to answer that question, the answer is yes. Okay, you still get tax relief if you top up $6,000 to their father's MediSave accounts. All right, so next up. Okay, I am 55 years old now. My MediSave account is now $63,000, which is the current basic healthcare sum. Assuming next year the basic healthcare sum is increased to say $70,000, can I top up my MediSave account to meet the to meet the new basic healthcare sum? If so, is it via cash? Okay, so to answer that question, actually, we have already announced the new figure for the basic healthcare sum. I think it's $66,000.
Yep.
Right, $66,000. So the answer to your question is yes, you can top up to meet the new basic healthcare sum. All right, so yes, it can be in cash. All right, whether you can use MediSave, whether you can use other CPF, I just need to confirm in a bit.
Yeah, maybe I can just add on.
Yeah.
So I think you were asking when you're age 55. Just to remember that the BHS is set when you are 65 years old. So it's a little bit different. So even though you're 55 years old now, for the next 10 years until you turn 65, your BHS will continue to increase. That's because the BHS is set at age 65. So that means in 2022, when the BHS is increased to $66,000, you can top up your MediSave to do so. And you can do it through your contributions. You can do it through cash. And
yeah, so let me just confirm this. Okay, how about this? Just give me a while while I get the answer. So let's move on to the next question in the interest of time. All right, so I think this is for Marcus.
Yeah, maybe I can read the question.
Sure.
Yeah, so are medical standards in B2 below in public hospitals, lower as compared to those in B1 or higher ward, higher, and the private hospitals generally? So this depends on what you mean by medical standards. As I shared, actually, more than 2/3 of our admissions for Singapore residents are in B2 and C class wards. So for many of people, they receive good subsidized treatments in the medical, in B2 or C class wards as well. B1 or higher class wards or in private hospitals depend on, they provide you with greater amenities. So you may have better food, for example, you have air conditioning. And for some people, that actually means an increase in their standard of care. So if that's what you want, sure, but because these are not basic healthcare needs, there will not be subsidies for you. The key idea of subsidies is that we provide subsidized basic healthcare needs. Anything additional, anything that is not fully necessary for your treatment will not be subsidized so much. So if you choose to stay in an A-class ward because you want better amenities, or if you want to choose your own doctor, that may indeed be higher medical standards for yourself, and that's a personal thing. And if you want so, then yes, maybe you should have an integrated shield plan. Yeah. So there's a decision you need to make for yourself.
Right. So coming back to the an earlier question, you can top up in cash. All right. You can't transfer your CPF savings to meet the basic help to your MediSave account. All right. So let's take the next question. All right. I think this part Marcus has covered. Probably it will be good to repeat also. Why are MediShield Life and CareShield Life subsidies tagged to income levels?
Yeah, so this is a good question. We know that subsidies are limited resource because subsidies are financed by tax. And tax money doesn't appear out of nowhere. Our government budget is limited. So why does it vary by income levels? It's because we want to ensure that people who need more help get more help. And that's a general principle in the Singapore healthcare financing philosophy. So those that can depend on themselves a bit more, you may not need so much government support. But we want to ensure that healthcare is affordable even for those that have lower income. That's why subsidies, even for MediShield Life and CareShield Life premiums, vary by your income.
I think, like what Marcus pointed out, I think end of the day it's a vicious cycle, I would say.
Yeah.
The more subsidies we give means the government has to pay more, right? So in the end, where the government need to get the money, mainly will be through the citizens, as well as the trade and all. So end of the day, we have to pay higher tax just to meet the higher subsidies.
Yeah.
So that is why there are different income levels designed to make sure those who need more help will get the help that they need.
Yep.
And those who can support themselves a bit more, then they get a bit lesser.
Yeah, so actually it's not correct to say like, oh, government pay more, so I pay less, or insurance pay more, so I pay less. At the end of the day, it's always the citizen or yourself paying. If insurance covers more of it, that means that your premiums will increase in the future as well. If government subsidizes more, that just means that the tax burden will increase as well. So in the end, it still comes out of your pocket. We are just trying to find out what is the best system to keep costs low for everyone, make sure that healthcare is affordable for everyone in the short term and in the long term.
Okay, so I hope that shed some light to how to the thinking behind when we are designing like subsidy structure for different healthcare policies. All right, I think next one is also a good question for Marcus as well. Is it correct that premium payable for CareShield Life is until age 67 only, after which no premium needs to be paid?
Yes, so this is correct. Your CareShield Life premiums are only payable up to age 67. But the caveat is that if you join CareShield Life a bit later, when you're a little bit older, you have to pay a minimum of 10 years for your premiums. So if you join, let's say, when you're age 65, you need to pay until you're 75, your CareShield Life premiums. Because you are still receiving the same benefits as everyone, it's a little bit unfair to the other people if you are only paying, say, 2 years of your CareShield Life premiums.
Right, so that's that. Let's take the next question. Okay, this one I can answer. In paying for my medical bills, which one will come in first, MediShield Life or MediSave? Okay, so earlier on, I think Marcus touched a bit on MediShield Life, or rather not a bit, a lot. Okay, on MediShield Life and how the payment structure is like. So just let me share a bit more. So at the very first layer of payment is really the portion of the bill that's above the claim limit. So that part we as the patient have to pay either through cash or MediSave. Then the next layer of payment will be deductible. Okay, so this is a fixed amount that we have to pay per policy year. So it depends on which ward types that you are staying in. So if I'm not wrong, for private or A-class ward, we are talking about $3,500 for the year.
I think it just caps at 3,000, 1,000 to 3,000.
Okay, 1,000, 3,000 if you are staying in like type A or private hospital. Okay, then the next layer of payment will be co-insurance payment. So typically it's a percentage between, I think, 3 to 10% of the remaining medical bills. Okay, then with that, the remaining will be covered for by MediShield Life. Okay, so your worry is, oh no, will all this amount add on to a huge sum? So I think like the study, like the example that Marcus shared for Mr. Tan, where he went through a heart surgery, and typically it's like literally one of the most expensive surgery, I would say. So with the bill of 50 over 1,000, in the end, Mr. Tan only has to pay about 10,000
Yeah, after subsidies,
After all the
10,000.
subsidies, 10,000, then plus
After MediShield Life, only about 2,000 left.
about 2,000. And that 2,000 can be paid for through MediSave or cash.
Yep.
Yeah, so it's really affordable and it's really amazing how all this, such a huge cost can come down to a fraction of it.
Yeah.
Yeah, so let's take the next one then. Okay, so this one I can. If I'm not on ElderShield, can I still join CareShield Life? I am currently 60 over years old with pre-existing conditions. Okay, the answer is yes, you can still join voluntarily. Okay, the only difference is you may need to do a disability assessment. We may require you to do a disability assessment. So basically, just to check your current physical or medical conditions, then we will let you know of the results. All right, so that's that. Okay, next question. Okay, this question is more for Marcus. Okay, will I have more flexibility in using my MediSave in old age since it is my own savings?
Yeah, actually, I believe this was already answered in the earlier, so maybe I just reiterate. The question is flexibility in use of MediSave. And the answer is yes, because we recognize that elderly do have more healthcare needs in retirement, and therefore we have introduced schemes such as Flexi MediSave, MediSave Care for your severe disability. And MediSave limits are generally pegged to needs. As you need more in your elderly years, you will use more of your MediSave. Yep.
Yeah. So that's, Marcus, we have gone through that question already.
Yeah.
So it's just repeating the key points. All right. So next question, also very interesting. Is CareShield Life only for the severely disabled?
Yeah. So that's correct. CareShield Life is only for severely disabled. And severe disability means you're unable to perform 3 out of 6 activities of daily living. So activities of daily living are such as washing yourself, transferring, feeding yourselves, walking around. I can't remember all 6, but you can find that online. So CareShield Life is only for severely disabled. But that doesn't mean there is no support for those that are moderately disabled. For those that have moderate disability, our usual healthcare financing schemes apply. If you go for long-term care, you need rehab in a community hospital, you can get subsidies. You have MediShield Life and you have MediSave as well. There are other schemes in place as well. You can go and find out more at the Agency of Integrated Care. For example, the Home Care Giving Grant, which provides cash payouts for those that are moderately disabled as well. So there's a lot of support, even if you're moderately disabled.
Yeah. So actually, the way I see that question is really asking is it designed only for those severely disabled?
Yeah.
Okay. So I think the key thing is we do not know whether we'll be severely disabled or not. It's really it's a question mark.
Yeah.
So that is why actually the government introduced this more to prevent. I mean, in the event if we get severely disabled, at least there is this so-called safety net to catch us, to help us pay for the medical costs. Otherwise, I mean, the long-term care costs, not medical costs.
Yeah.
The long-term care costs, which can come up to quite a huge amount.
Yes.
Especially if we need a lot of mobility aids. Like the hospital bed itself, it costs a few $1,000s.
Yeah.
Okay, so let's take the next one. Okay, how do I check whether I'm covered under ElderShield or CareShield Life? All right, so it's still the same, like what I mentioned. Just log into your CPF account using SingPass, and then you can get to, just scroll down, you will see your coverage. All right, next question. Okay, for CPF members who are between 54 to 70 years old now, when will we receive the letters to join CareShield Life? Okay, if I'm not wrong, we have already started sending out notifications to those who are, to invite those who are on ElderShield to join, the age group to join CareShield Life. Probably the letter hasn't reached them.
Maybe.
Yeah, it's sending out in batches. So just be a bit patient. It will come to your mail letterbox soon. All right, next up. I have comprehensive insurance today. Can I withdraw my MediSave savings or have a lower basic healthcare sum?
Yeah.
Marcus?
So this is a difficult question, and a question that we get quite often. So you have comprehensive insurance today. I assume that means that you have comprehensive private integrated shield plans. You may even have CareShield Life supplements. So you think you are fully covered. But I go back to the slide where I talked about do I need an integrated shield plan? On that slide, you saw that integrated shield plan premiums can be very high, especially when you're in 70s or 80s. And that means when you stop working. So you may have comprehensive insurance coverage today when premiums are lower and more affordable, but that doesn't mean you have comprehensive insurance throughout your elderly life as well, because this status can change. And if it does change, MediSave is there to help you afford the healthcare costs because your integrated shield plan coverage has been downgraded. The second point is that MediSave covers you for things that insurance may not cover you fully. For example, if you have a chronic condition, you go to a MediSave accredited GP, and you need, say, diabetes consultation. This can add up quite a lot over the years. But currently, MediShield Life or your integrated shield plans may not cover it. So there's a need to still have MediSave to plug the gaps around your integrated shield plan, even if you have integrated shield plan coverage throughout your life. So it's important to have MediSave as another layer of defense for you.
Yeah, so I mean, I echo what Marcus have shared. So actually, in my same like I mean, in my groundwork also, I do get some seniors coming to me to say, like, oh, I'm under integrated shield plan. Like, if I have plans to so-called downgrade my integrated shield plan, can I go back to MediShield Life?
Yeah.
Yeah. Then I say, hey, why? Why is that so? And then that's where they start the increasing premium because actually, I mean, when you retire, actually, it can be a significant amount of cash outlay also. Yeah. So I think end of the day, it's not that we should all drop out. But end of the day, it's really take a look at, assess your own financial circumstances, and then assess whether is this something that you can afford in your retirement years. Yeah, I think that's the key consideration.
That's correct.
All right, so, okay, let's take the next question. Wow. Okay, how often is means testing done for citizens who have chronic medical condition?
Yeah, so this is an operational question, and I am not fully aware how often or how regular means testing is done. And I do not believe that it depends on your condition as well. Means testing ensures that people who need more get more. And if you feel that your means test is not accurate to your income level, you can talk to your public healthcare provider. You can talk to the business office, and they most likely will be able to reassess your means test, or they will send an email to MOH to see whether your means test is appropriate to your per capita household income.
Yeah. So maybe to add on to what Marcus shared, actually in all polyclinics and government hospitals, there's always an office where you get to meet the medical social workers. Yeah. So that is where they speak to you to assess your circumstances, your financial situation. Then that's where they will recommend the appropriate amount of subsidies. So rest assured, like what we say, no one will be denied healthcare due to inability to afford the bills. All right, just speak to the medical social workers at the respective institutions. All right, let's take the next question. If insurance doesn't cover the existing illnesses, then what is the point of getting insured? Okay, so I think this is a very good question. So just want to share, that is exactly the point that we're trying to cover when we introduced MediShield Life back in 2015. Yeah, because if for those who have been through MediShield period, you know that there's a certain age limit and there's also certain exclusions. Okay, but under MediShield Life, that is where universal coverage comes in. Okay, so those with pre-existing conditions, you will also be covered. Okay, and those with severe pre-existing conditions, that's where the hospital will assess, or rather MOH will assess to see whether there is a need to add on a little bit of premium loading, etc. Right?
Yep. So that's the point of MediShield Life really, is to help people who may have pre-existing conditions and find it difficult to get insurance coverage in the past. With MediShield Life, everyone is covered for life, regardless of pre-existing condition, regardless of age. For integrated shield plans, they are run by private insurers, so they have the discretion to exclude pre-existing conditions for yourself. So MediShield Life really helps you. And CareShield Life as well, they do not exclude any pre-existing disability.
So coming back to my own story is really, this is where, you remember just now I said one of the hospitalization, I didn't know and I paid for the full bill, right? So I said, darn, I need to pay $10,000 for the operation. Then, wow, there's a shining light at the end. Then when I see the final bill, right, I actually saw, there's a little bit of MediShield Life payout. I was like, okay, I managed to save a little bit, like 10%.
Yeah.
I was like, okay, thank goodness I saved that little bit. So that's exactly what we have been saying. You are not, you will still be, MediShield Life still payouts for different higher ward types, just that it might be lower only.
Yeah. So it's important actually to avoid having to pay out a lot for, say, something that is excluded. It's important to understand what your insurance, your IP covers you for. Sometimes they may provide what they call letters of guarantee. But letters of guarantee doesn't mean that they will absolutely pay out. It's just a waiver of the deposit. So it's important to check whether, I think some of them have pre-authorization now. So pre-authorization is a guarantee that they will pay out. So must understand the difference. A letter of guarantee doesn't mean that your insurance agent will pay out. It's just a waiver of the deposit upfront.
Okay, okay, let's take the last 3 questions because we're running out of time. Okay, so next question. Oh, I think I covered it a little bit earlier. I'm a retiree and I'm currently insured under Integrated Shield plan. Can I revert back to MediShield Life? All right, so this part I actually covered already. So, and Marcus also covered in his presentation. So actually, how Integrated Shield plan works is there will always be a MediShield Life component inside. So in fact, if you have your most recent premium letters, you will see there's a very clear breakdown now. Like usually the first column where we talk about MediShield Life, and then what's the premium and how is it paid for? Is it MediSave or cash? Then the next layer, that's where the Integrated Shield plan kicks in. So rest assured, you are not double insured. You're not paying double premium. There's always a MediShield Life component in all your Integrated Shield plan. So you can actually drop back to MediShield Life if you feel that you don't need the Integrated Shield plan.
That's correct.
All right, let's have, okay, so the next question we actually covered already. Can we transfer ordinary account and special account monies to the MediSave account annually? If I'm not wrong, the answer is no. You can top up in cash. Okay, so last question. All right, so does the parents' MediSave account can parents' MediSave savings cover for children's healthcare costs? If yes, how it works? And how do I check if I can use my MediSave to pay for the medical needs of my dependents? Okay, so being a young parent, because I have 2 kids, a toddler and a newborn, I can answer this question. The answer is yes, you can. So actually, I've been using my MediSave to pay for my kids' insurance plans, as well as sometimes we do get medical emergencies, then I use that to pay as well. So that's possible. And of course, whether for your dependents also, how do I check if I can use? Okay, so as long as it's immediate family members, you're allowed to use your MediSave to pay for dependents.
So approved dependents now means your parents, your children, your spouse, and your Singapore citizen or permanent resident siblings and grandparents. So that's who you can use your MediSave for, what we call approved dependents.
All right. So what about non-approved one, like uncles and aunties?
So non-approved, no, you can't use. But if you really, if your uncle or your auntie really has nobody else to depend on, you can talk again to the medical social worker, and we will see whether MediSave is the appropriate way to help you.
Oh, yes, or whether there are other assistance schemes to help.
whether there are others.
So I think that's very important. So with that, so just to share, if you are interested in the topics that we discussed, actually there are a lot more information on the CPF website as well as the Ministry of Health's website. So you can pop by there after the session to find your answers. All right, so with that, we are really thankful that we have you with us tonight. And I'm actually very thankful for Marcus to really share about the healthcare financing system, because it's a complex system and very comprehensive. So it's very important that we all know how it works. All right, so thank you everyone. Have a great week. And now let me pass the time back to Mei Fang, who will bring you through the end of the session.